Good morning. If you're just joining us, we're going to get started with our webinar in just a couple of moments. Good morning, everyone. Thank you for joining us. This is the Greater New Haven Chamber of Commerce and Quinnipiac Chamber of Commerce COVID update. Lots of information to share with you this morning. We'll give everyone just one more minute and then we will get started. All right, again, thank you everyone for joining us. My name is Garrett Sheehan. I'm President and CEO of the Greater New Haven Chamber of Commerce, and I'm glad to bring you this COVID update, updated information and protocols. We were hoping we wouldn't be back in this situation, but obviously with the Delta variant, this is causing a lot of problems across the country, but also in Connecticut, and really critical for business as well. Many issues to talk about, and we have a full panel for you today. We're going to talk about all aspects of COVID, from what's going on with the virus to the vaccine, how certain businesses are handling it, what to do with your employees. We have attorneys, business owners, health professionals, all joining us so we can approach this from many different angles. Want to get started, and before we do, thank all of our investors here in the chamber who support us throughout the year. It's with their support that we are able to put on programs like this, and also in-person events. We have one coming up on August 31st as well. So a big thank you to all of our investors. Also, this presentation today is brought to you by two of our councils, our Healthcare and Life Sciences Council, which is presented by Harvard Pilgrim Healthcare, and our Human Resource Council, presented by Carmody, Torrance, Sandeck, and Hennessy. I want to welcome in Shannon Duncanson, Sales Executive with Harvard Pilgrim Healthcare, to kick us off. Shannon.
Thank you, Garrett. Harvard Pilgrim Healthcare is happy to offer employers another choice in healthcare insurance for their employees here in Connecticut. As the only not-for-profit health insurance carrier in Connecticut, Harvard Pilgrim Healthcare is proud of its partnership with the Greater New Haven Chamber of Commerce. At Harvard Pilgrim, we continue to look for many ways in which we can strengthen the communities in which we live. Through our foundation, we have shown our commitment to our communities by giving over $1 million this past year in grants to local businesses. We've also made contributions to local food banks to address the needs of our friends, families, and neighbors. Today, we are pleased to sponsor today's session related to the COVID vaccine and protocols, and I look forward to hearing from the panelists. Thank you.
Great, thanks a lot, Shannon, and we appreciate the support from Harvard Pilgrim. So as I was mentioning, we have 6 panelists with us today, and we're going to approach it from many different angles. Just to give you an overview of the format, we're going to go through each of the panelists, have them speak about their area of expertise, and then we're just going to open it up to your questions. So we'll start off. Our first panelist is Emily Zach-Lukowicz, an attorney associate with Robinson and Cole. Emily, thanks so much for joining us.
Thanks so much, Garrett. Good morning, everyone. My name is Emily Zach-Lukowicz. I am a management side labor and employment attorney at Robinson and Cole. At a very high level, my practice is kind of twofold. On one side, I represent employers in state and federal court and before administrative agencies like the CHRO and the EEOC. And then on the other side, I counsel employers on kind of all things labor and employment. So over the last year and a half, one large part of our counseling practice has been counseling employers on the many COVID-19 related issues that they're facing in their workplaces. Not surprisingly, 2 of the most notorious topics that employers have been asking about over the last several months have been vaccinations and face masks. So to give kind of just a very high level overview, because I know I could personally talk about these issues all day. On the vaccination front, one of the biggest questions that employers are grappling with right now is whether they should mandate the vaccine for employees or whether they should instead just stick to encouraging or otherwise incentivizing the vaccine. You've likely seen in the news, though, that more and more employers are beginning to require vaccination or at least some type of testing alternative to vaccination in their workplaces. So to set the stage under state and federal law, employers generally have this obligation to provide employees with a safe and healthy workplace. So there could potentially be an argument that encouraging vaccination, along with implementation of other precautionary measures like face masks or social distancing, are steps that employers should be taking to fulfill that obligation. But at the end of the day, each business's approach to the vaccine is typically gonna depend on several factors, including the industry and industry standards among similar organizations. For example, is the employer in healthcare, or are they operating in a healthcare setting? Other concerns may be what percentage of the workforce is vaccinated, employee relations issues, the risk of vaccinated employees to other employees or to third parties. So are employees interacting with the public? Are they working in congregate settings? So on and so forth. So each workplace's approach to the vaccine is typically going to depend on a case-by-case basis. As a very general matter, the EEOC has put out clear guidance saying employers can mandate the vaccine regardless of industry, but certain exceptions need to be made for those who are unable to be vaccinated either because of a religious belief or because of a medical condition. So I'm sure we'll get into some of the legal risks with mandating, but there certainly are a host of risks. And then due to some of those legal risks, other employers are deciding basically just to incentivize or otherwise encourage the vaccine, either through informational campaigns, incentives like raffles, bonuses, paid time off, stuff like that. So at the end of the day, for employers implementing any type of vaccination policy, whether it's mandating the vaccine, incentivizing the vaccine, or some type of in between, it's going to be really important to clearly convey to employees what the policy is, what you're trying to accomplish through that policy, and what the potential consequences may be. And I will leave you with a note that, I mean, these issues are changing very rapidly day by day. So it's going to be important to fully understand and remain up to date with the changing information. But I'm looking forward to hopefully a great discussion on the whole mandating versus incentivizing dichotomy.
Thanks, Emily. Appreciate it. Let me welcome in Stephen Gestalder, who is Vice President of Library and IT Services and head of their COVID-19 committee at Albertus Magnus College. And Stephen, there's the employee side, and also you're welcoming students back to campus this week. So thanks for joining us.
Yes, thank you. Good morning. And thank you, Garrett, for inviting me to join this panel with these esteemed experts and to represent Albertus Magnus College and talk through what our policies and procedures are that we're taking to protect our community from COVID-19. So yes, Albertus Magnus College is open for the fall semester for regular on-campus classes. We're returning as much as possible to pre-pandemic instruction and activities. We're excited actually to welcome our second largest incoming class. We're continuing the growth agenda that was started by Dr. Mark M. Camille, but that was rudely interrupted last year by the shutdown. Classes start this Monday, and for our adult and graduate students, actually, they started this week, but most of those classes are online or are blended. Our move-in begins this Friday, August 27th. And since we all help moving in our new students, we are hoping for temperatures that are less than 90 degrees, but we're also happy that Henri is now passed. Some students have already returned to campus, including our student athletes and our graduate assistants. All of our students are required to send in pre-arrival negative COVID tests to the college, but we'll also be providing arrival testing for students on campus. So one of the four pillars that supports the Catholic Dominican tradition is community. And for the health and safety of our community, and in the face of overwhelming scientific data and consultation with medical and with our legal experts, the college does require all students, faculty, and staff to have a vaccination against COVID-19 as of July 1st, 2021. We do allow exceptions for exemptions, applications for exemptions based on medical concerns from everyone in the community. And we also accept applications for exemptions based on religious concerns by faculty and staff. Anyone granted an exemption will still have to be tested on campus twice each week. We've also partnered with Griffin Health to provide weekly vaccination clinics on campus and we welcome members of our neighboring communities to those clinics as well. All visitors to campus are also asked to bring proof of a COVID vaccination or a negative COVID test conducted within 72 hours of visit, and to register with the sponsoring office for the visit for contact tracing purposes. Masks are required inside all of our buildings and by everyone. Outside, we tried to relax the policy a bit, particularly for our athletes, and allow members of our community to not wear masks as long as they display their Falcon ID card. But we ask that all visitors wear masks at all times while on campus. The college provided a 6-week grace period up till August 16th for the community to submit proof of vaccination or to start the exemption request process and stay in compliance with our policy. And for this exemption application process, we've set up a panel of staff to review the applications following guidelines that were established with our attorneys at Littler. But even prior to our decision to require vaccinations, our COVID work group developed numerous strategies and campaigns to get our community to send in the vaccination cards. Our understanding for most of the summer has been that most of our community have had the vaccine, but just have not told us yet. I mean, I understand. I've got a 20-year-old at home. I had to battle him to get him to send in his vaccination card even. We understand that some people have had concerns and needed more information. So over the summer, we also held a webinar with experts regarding the virus and vaccines. And we sent weekly updates of messaging to our community. And we've also run weekly incentive drawings for giveaways for those that have submitted their cards. So as we approach moving day this Friday, 90% of our full-time employees have already submitted the vaccination cards, although we expect there are more vaccinations out there, just some folks are still on vacation. Our students have a few more days to send in their cards, so we've not run the final data, but at this point, we're above 70% of our undergraduate students who have been vaccinated at this point. For all of our current policies and for ongoing updates and to see our testing data, come see our COVID-19 fall plans page on our college website. And thank you for allowing me the time to explain how Albertus is opening for classes and for business this fall.
Great, thanks, Stephen. And we'll check back in with you as we get the discussion going. Want to welcome in Frank Patrick now, managing partner at Bar New Haven. And some of you may have seen stories in the news in the last few weeks, and where Bar was one of the first restaurants to require vaccination or a test to be able to enter the establishment. So Frank, thanks for joining us, and tell us just a little bit about how that policy has been going. I see we have Frank there. Frank, can you hear me?
Can you hear me now?
Yeah, now I can hear you. Perfect.
All right, we got it. All right. Yeah. So it's been a little bit difficult. It was rough. We started the policy a little bit earlier than a lot of other places did. I wanted our customers to get used to it ahead of time, but it's been a little difficult. We're finding a lot of people are vaccinated, but they don't have proof of it or don't have it readily available. But I think as time goes on, it's been getting better. This past weekend was easier. So.
Great. Well, thanks, Frank. And we're going to continue the discussion. We'll just introduce the rest of our panelists, and we'll come back to Frank and everyone else. I want to welcome in Dr. Levita Robinson, Assistant Medical Director at Cornell Scott Hill Health Center. And Dr. Robinson, thanks for taking the time to join us. What are you seeing as far as people's hesitancy to the vaccine, and have more people been willing since we've seen this surge in the Delta variant?
Hi, good morning, everybody. I'm so happy to be joining you all today. So, I think one of the biggest things that we've seen as it relates to hesitancy amongst, people in general, there have been people that in the very beginning were concerned about the fact that the vaccines that we have were under emergency use authorization. And we did have a subset of people who were really just kind of holding out for that FDA approval. The good news is that as of today, we do have a COVID vaccine that is FDA approved, the Pfizer vaccine. So for some, patients, that was, an extra added bit of assurance that really, made them feel more confident in kind of pursuing vaccination. There are also some people who, said despite, FDA approval, they still were concerned about being vaccinated because they were concerned about quote unquote long-term side effects. Like, what will happen after I get this vaccination, 10 years down the road? Will we be, hearing about, potential harms that this vaccination could have caused. And a lot of that really just has to really deal with kind of making sure that we're educating people about that. When it comes to vaccines, the majority of vaccines kind of have the same endpoint in which they're allowing our body to create antibodies to fight off potential viruses and infection that we get exposed to. With the mRNA vaccines, for example, with Pfizer, Moderna, when after that vaccine is injected into the body and it does its job to give you the instructions to create these antibodies, that vaccine is actually destroyed. And so the mRNA, particles in that vaccine aren't lingering around the body long term. Also, in the history of vaccinations, which would include the COVID vaccines, we've never seen long-term side effects that people have from a vaccine beyond the 2-month period. And so the likelihood of someone developing a severe long-term side effect of a vaccine happening out of the blue, 5, 10, 15, 20 years from now is really unheard of. And the likelihood is very slim to none. I've had some of my own patients where, in the very beginning, they were hesitant about it. But I think now that we're in a new state with this pandemic, with the Delta variant, and seeing just how more contagious it is, I think one of the things with this new strain that we have now is also seeing people that are seemingly younger and also seemingly healthier that are also getting affected by it, but not just getting a mild infection. Some of these younger and quote unquote healthier patients are also getting more serious illnesses, are having to be hospitalized and having to be intubated, and some of them have actually died. And I think that is also a turning point for a lot of people, where I am seeing some patients of my own that were very hesitant and resistant to the idea that now are having a change of heart. With that being said, for some people, the employer mandates was the kind of final push for them to get vaccinated. And so we've also seen a lot of patients who've been coming in and say, well, you know what, my job is requiring me to get the vaccine, so I'll go ahead and get the vaccine. And so, and they're not really giving us that much pushback about it. So, so I think we will see, in these, coming weeks to month, that you're going to see kind of even more people coming to get vaccinated. And we always like to respect people's, opinions. But one of the things that we do when people come to us and they kind of approach us with, questions about the vaccine is making sure that we're educating them and providing them with the best information.
Great. Thanks, Dr. Robinson. We'll come back to you in just a couple moments. And one of your colleagues, Sarah Killing, with the COVID-19 vaccination program director and assistant director of school-based health at Cornell Scott Hill Health Center as well. And so, Sarah, I know you're out going anywhere you need to be able to deliver the vaccine to people. Tell us a little bit about how that effort's been going, and has it increased in the last several weeks?
Actually, yes. So thank you for inviting me. We have actually luckily seen a pretty good increase in the last few weeks. And I would have to say, along with Dr. Robinson, some of those mandates have really helped, especially initially with colleges. We saw a pretty good increase there for a bit. And now with teachers and state workers, we haven't seen any specific huge spikes of people, but our numbers have been trending up, which is really good, especially after we hit a very significant low at the end of June. We've gone up and up every week since then. So we're still trying to get our message out there, trying to make sure that we answer questions, get on formats like this so that we can be available and let people know what their options are. Like Dr. Jensen said, we really want to make sure that we give the education, not just the vaccine, but so that people make an informed choice that they're happy with and they're not miserable and upset that they had to do this. We are available at all of our locations. We have testing and vaccines. We have mobile pop-ups every single day of the week, almost for the whole summer, including weekends. We're at all sorts of events all over the place, and just trying to make sure that we bring the vaccine and the education out to the community so people have a well-informed choice.
Great, thanks, Sarah. We'll come back to you. And we have one last panelist, last but not least, Sarah Westby. She's an associate with Shipman and Goodwin. And I also, before we have Sarah speak, just want to remind everyone you can put your questions in the chat and the Q&A, and we'll start jumping into those in just a moment. But Sarah, anything in particular you want to share with us, especially on the employment front, and especially As we hear about these employee mandates, any pushback or issues that employers are facing?
Sure. Thanks, Garrett, and thanks for having me today. My name is Sarah Westby. I'm an attorney in the employment law group at Shipman and Goodwin. We have offices here in New Haven and also Hartford, Stamford, New York, and Washington, D.C. And like Emily, I represent primarily employers in litigation and also counsel clients on a broad array of employment issues, from discrimination to federal and state leave to hiring and termination practices. I also have a background in complex litigation, including pharmaceutical and medical liability, which has provided me with a nice background overlay for these types of vaccine questions that we're getting now. Over the past year, I think like everyone on this call, I've been spending a significant amount of time dealing with COVID-19 issues. First, with respect to remote work, and then with respect to return to work and masking and office safety protocols. And now the hot topic is, of course, vaccine mandates. So the main questions are, and I think Emily provided a nice overview, so I'll just highlight a few points. The main questions are, can employers require the vaccine? Should they require the vaccine? What type of exemptions do they need to consider? And what types of reasonable accommodations must they and should they provide? Some of the questions that we've been getting from clients are, if employees are requesting exemptions that the employer thinks are not really grounded in fact or in an actual medical condition, can the employers push back? Can they require corroborating evidence? Can they ask follow-up questions? And in a lot of circumstances, that depends, right? So with a medical exemption, the employer is entitled to obtain corroborating documentation from a healthcare provider. But with an exception based on a sincerely held religious belief, the employer is more limited. And the law says that generally you need to take the employee at their word unless there is objective evidence that the employee's belief is not sincerely held, or it's not grounded in religion. Perhaps it's grounded in misinformation or social or political views. And in that case, the employer can ask additional questions and can even request a reference related to this sincerely held religious belief. So those are a lot of the questions that we're getting right now. What can employers do if they suspect that their employees are abusing these exemptions? Are there other exemptions the employer can consider, including just people who don't think the vaccine is safe or just don't want to get it for whatever reason? Can they simply wear a mask and agree to get tested on a weekly basis? And if the employer does allow that option, who's going to pay for it? That really depends. There's no one size fits all approach, and the employer needs to consider its own cost considerations and the burden of those accommodations and the effect it's going to have on the workforce and the people that the employer serves. Another question is the continuing role of remote work, and can and should employers allow employees to continue to work remotely as an accommodation? So I know that's a lot of information, but looking forward to diving into some of these topics.
Great, thanks a lot, Sarah, appreciate it. Maybe I'll turn back to Dr. Robinson just for a moment. And Doctor, if you could talk a little bit about what's different about Delta. All of us have had to kind of change our understanding of where we were in this pandemic. It was only a couple months ago we were celebrating the vaccine, and you get the vaccine and everything's good. And we've had to readjust our understanding of what's going on right now.
Yeah, I mean, I think with Delta being kind of the most predominant strain, it really it changed the course of this pandemic. When we look at the Delta strain, one of the things that makes it very different from the original strain of COVID, and I think a lot of times when people talk about COVID and they say, oh, it's just an illness that really affects older people, they are primarily thinking about the original strain of COVID, which we kind of refer to as the wild type in the scientific community. Nowadays, if you're getting infected with COVID, the likelihood that you're getting infected with that original strain of COVID that first came here in early 2020, that strain is not really here right now. We're primarily dealing with the Delta variant is the predominant strain. And so with viruses, over time, they change. The longer they're around, they can mutate. And sometimes that mutation or that change makes it not as infectious, but other times it can actually make it more infectious. And what we're seeing with the Delta variant is that it's a lot more stickier, meaning that it actually can latch onto the cells a little bit easier. And with that, it can cause someone to become sicker a lot easier. Additionally, it's a lot more contagious. So with the original strain of COVID, one person who got infected, maybe they could spread it to 2 or 3 people. With the Delta strain, we're seeing people spread it to 5 people, upwards of 8 people. And so that is the reason why the researchers that are looking at Delta have said that the Delta variant is similar to chickenpox. So they're kind of comparing it to what are some other infectious illnesses that are out there that are so contagious that if one person has it, everyone around them, gets sick with it. And so that's what we're dealing with here. And that's why you saw, we had this low where the numbers were going down significantly. Delta came here to the United States, and then you just had this exponential rise in people that were testing positive for COVID and exponential rise of people that are actually getting hospitalized. The good thing is that the vaccines that we do have still are protective against the Delta strain, and that if you get, God forbid you get infected with Delta, if you've been vaccinated, the likelihood of you getting sick to the point where you have to be hospitalized is still very low. And that's the reason why many doctors, healthcare professionals, public health professionals, for example, are really focusing on people getting vaccinated. The other thing that I do often tell people is that we do have some treatments for COVID. They're not cures. So I like to really emphasize that they're not cures. But even with those limited treatments that we have, those treatments, people can get COVID and they may not work. So the example that I give are the monoclonal antibody infusions. So Regeneron is kind of one of the name brand monoclonal antibody treatments that people have heard about. It is the one that former President Trump received when he was diagnosed with COVID. But even, prior to Regeneron, we had 2 monoclonal antibody treatments that people could get. Now we're actually down to 1. And the reason for that is because prior to the Delta strain, we had more than 1 monoclonal antibody treatment that was, shown to be effective. With the Delta strain, one of those monoclonal antibody infusion treatments isn't really, causing much of a dent in people getting sicker, even if they receive it. Also, with the monoclonal antibody treatments, people have to get those infusions very early on into their illness. So sometimes we kind of linger around and think maybe it's not COVID, maybe it's something else, maybe I just have a summer cold. And so sometimes people are delaying when they get tested for COVID. And by the time they actually get tested and get their results, maybe a whole week has gone by. And so if you're relying on getting an antibody infusion and that being the answer, that is not always the case. Sometimes you can get that antibody infusion a little too late. And we are seeing that, even some of the southern states. Additionally, we have some treatments that are given in the hospital setting, but again, you've got to be sick enough to be in the hospital to receive those. And there have been people that have received those treatments in the hospital and still wound up in the ICU and still, wound up dying from this. So another reason why, even though we've got some treatments out there, they're not cures, and people still have succumbed to this. And so this is why the focus on vaccination and prevention is really the messaging that we're trying to send.
Great, thanks, Dr. Robinson. Let me delve into with both of our attorneys, Sarah and Emily. We have some questions on here about what employers can ask. Last year, this time we're dealing with where were you traveling? I have a question in the chat, people asking about, can you ask employees where they have traveled in order to require a test? And then also, what are some of those rules again about being able to require vaccinations? And I guess, what are some of the examples that you're hearing from employers right now about how the implementation of those rules are going as they go forward? Maybe I'll start with Sarah and then we'll jump over to Emily.
Sure. So thanks for the question. So in terms of the issues that we're seeing, haven't seen too many issues with regard to travel now. I think that the rules are pretty much set from what they were a year ago. If employees have traveled out of state, if employees have traveled anywhere where they suspect transmission of COVID, then they're required to follow the protocols, whether that's staying out of the office, masking, testing, et cetera. I think because COVID has really overtaken the nation now, it's not so much a question of hotspots and where there are these areas of increased transmission. You know, COVID is everywhere, so people are expected to, you know, follow the same safety protocols no matter where they've been. I think a lot of the focus and the issues that we're seeing now surround vaccines, masking in the office, and what can the employers require of their employees. So in terms of, you know, some of the exemptions that, and the questions regarding exemptions that we're seeing, employers want to know what they can ask of their employees, and employees want to know what their employer can require. And the answer to that is different based on whether they're requesting an exemption based on a disability or an exemption based on a sincerely held religious belief. So under either standard, the employer has to grant a reasonable accommodation, assuming that the person qualifies for either exemption, unless that exemption presents an undue burden or an undue hardship. And with the case of a disability, even if that exemption and accommodation were granted, if there's a direct threat to public health and safety, the employer doesn't necessarily need to grant that exemption. So with respect to the medical exemptions, as I said in the intro, the employer can request medical documentation. But with request to the religious exemption, typically the employer has to have some basis for believing that there is not a sincerely held religious belief, or it's not in fact a religious based belief, but it's more political or social, or it's based on some kind of misinformation. So what if the employer has such a basis, and that basis could come from the employee's previously expressed skepticism about religion. So the person says, you know, I think all religion is pointless and I don't believe in any of it. Another example might be if the employee has signed up for a vaccine clinic in the past. That would give the employer a basis to think that maybe they don't have a legitimate religious objection to a vaccine. If there are circumstances like that, the employer can ask for additional corroborating evidence, such as a reference, and that could come from a member of the clergy or another congregant in the employee's religion. It could come from literature that maybe describes that the religion objects to this vaccine for some reason, or some other type of documentation that shows that this is a sincerely held belief of the individual and that it is tied to religion as opposed to something else.
Thanks, Sarah. And Emily, as we're talking through this, how, as employers are working through these issues, if they do decide to have a vaccine mandate, how are they able to, I guess, not disclose someone's health information if they end up having to take different precautions for different people? Are there concerns that they should be aware of now that we're dealing with someone's personal medical information?
Yeah, that's a good question, because that tends to be kind of a slippery slope, because preliminarily, both proof of vaccination and someone's status as being vaccinated or not vaccinated is going to be confidential medical information as it relates to employees. So that means it needs to be maintained in a separate medical file, separate from the personnel file. It needs to be confidential. It shouldn't be disclosed to anyone else who doesn't have a business need to know about that information. But then you kind of have the issue of inadvertently disclosing someone's vaccination status and therefore their medical information by virtue of, say, a masking policy that all people who are unvaccinated don't need to wear a face mask. Because of that, we generally tend to advise that it may make more sense in some circumstances to still encourage masking of all employees, but if you are vaccinated and you don't feel like you want to wear your face mask anymore, you can take it off. Of course, that's going to depend on, for example, the city of New Haven. Face masks need to be worn indoors, so local and state face mask requirements still need to be adhered to. But it's definitely a slippery slope in terms of the inadvertent disclosure of someone's vaccination status. And you want to be careful not to unintentionally either disparately impact different protected classes of individuals. Like, for example, someone is unable to get vaccinated due to a medical condition or a disability, and everyone's wearing a face mask except for them, there is a risk that you could be disclosing their vaccination status. So like I said, it may make more sense in some circumstances to say we still encourage everyone to do this, just so that it's not an intentional policy of differentiating based on someone's protected class. I don't know if Sarah would have anything to add to that.
Yeah, that's a really good point, Emily. And I'm sure you're seeing these questions. We are too, but a lot of employees are saying to their employers, you can't ask about my vaccination status, or I don't have to tell you that information because it violates my HIPAA rights. And so I think that's a very common misconception among people, that HIPAA protects all medical information, all disclosure of such information in any setting to every person. And that's just not true. HIPAA applies to covered entities, which are healthcare providers, health insurers, and healthcare clearinghouses, and certain of their business associates who handle protected health information. And it typically does not apply to most employers and employees. So employers certainly can request vaccination status and proof of that status. But as Emily said, once the employer obtains that information, they do have a duty to keep it confidential, to keep it segregated, and to ensure that they don't misuse it or disclose it outside of that protected employer-employee relationship.
Great. Thank you both for that information. Let me turn to Frank, because Frank, we're starting to get some questions about how you're handling checking vaccine cards at BAR. And also, I saw a question also on the chat asking about whether holding events and how people are handling that. And you obviously have a lot of people that come through the venue each weekend and throughout the week. So tell us a little bit about how you've handled events and the actual process of checking someone's status.
Well, we already have a security staff in place because we have the dance club. So it's just an added step for my guys to, rather than just checking the age, to ask for the ID for the COVID. We've been pretty lenient as long as they have a picture of it on their phone, or they could just prove it to us. That's how we've been doing that. As far as the events go, when you have an event at BAR, you have to fill out a page anyways, and that's on there. You have to check the box that shows that you understand the policy on the COVID vaccination. So I've only had a couple large groups concerned about that. Most of them were fine with it. And a lot of them are just checking to get back with me. They have to make sure everybody in their group has it. So it really hasn't been a negative impact on our large event business so far. And what I'm finding now is too, that more and more other establishments are requiring this. It's getting easier. So we've been doing this for 2 weekends now. And, yesterday there was no pushback whatsoever. Everybody had it. And I think a lot of people are beginning to expect that a lot of places are going to check it anyway. So it is, as time goes on, it's getting easier for us.
Thanks, Frank. And Stephen, you were talking a little bit about also with students coming back on campus, the faculty, getting people into that mindset that these are the requirements. And what have you heard? Are there things that you're hearing from employees or students that are creating challenges that you're having to deal with?
We have. I mean, I think with any community, there's some students and faculty and staff that are concerned with the requirements we put in place. But for the most part, we've been really pleased with the way that our community has pulled together and recognized the importance of adhering to the policies that we are putting in place, I think, and recognize the reasons that we're doing this, which is to get us back fully on campus and provide us really is the best educational experience that we can for our students. Well, keeping everyone safe as well.
And Sarah Keeling, just wanted to ask you as well, if an employer feels like they have employees who want to take the vaccine, or any type of, I guess, organization, what do they have to do? They just reach out to you, and you guys are setting up mobile clinics?
Absolutely. We're setting up mobile clinics. We can also direct them to the closest location if they don't have enough people for a full clinic. But mostly if they just get in touch with us, we can work together to find out what works best for them. We do evenings, we do daytime, whatever works. Most people like Fridays, so they don't have to worry about side effects, but we'll do whatever we can to get as many people vaccinated. So just give us a call or send us an email.
And when you do have people are coming up now for their first vaccine, what are some of the concerns that they've had or that they've overcome to be able to get to that moment?
A lot of what we've been hearing was that they were just waiting. They were honestly waiting to see. They just wanted to make sure that it was going to be something that was really needed. Delta has been a great push in a bad way, but also people are seeing that most of the people in the hospital are unvaccinated and they are really at risk. So a lot of the hesitation is slowly coming around as people get more and more information, as they feel more comfortable with the vaccines.
Let me turn back to Dr. Robinson because, Doctor, we've had a lot of questions about Delta. And as you mentioned, this is a very different phase of the pandemic that we're dealing with now. We have much more contagious virus, but at the same time, we have a very highly vaccinated, especially in Connecticut, vaccinated population, which is countering a lot of that. And I know this has created a huge issue on just the communication because for so long, we talked about just get vaccinated. Now we're back in still get vaccinated, but wear a mask in some cities, you don't have to wear a mask in other places. Some activities are safe, some are not. So can you give us a little bit more clarity on how we should judge all of the risks that are out there?
Yeah, and I was actually just kind of looking at the Q&A, and I see where someone had kind of mentioned wanted to see about us talk about the actual data about of the residents that we have in Connecticut, the actual percentage of positive cases, and looking at how many people in Connecticut are actually having to be hospitalized and how many people are dying from COVID. And I think, if you compare where we are now in terms of deaths and hospitalizations compared to, this time last year, or even like, spring of 2020, it's drastically different. So our numbers are a lot lower compared to then. And a lot of that honestly is a testament to vaccination. And so, on the flip side, if you were to compare us to say Florida or say Alabama, Mississippi, Louisiana, it's a totally different story because their vaccination rates are so low. They are seeing more people dying and being hospitalized for this. And we quite frankly don't want to get to that point, ever again. As of today, Connecticut, I think we were number 2 in terms of number of persons over the age of 12 vaccinated against COVID. We have dropped down to number 3, but we're in the top 5, and we've been that way for a while. And I think us being such a highly vaccinated state, it's the reason why we're able to maintain those numbers. Also, when it comes to being infected with COVID, I think some people, when the CDC had mentioned that, hey, if you're fully vaccinated and you catch COVID and it's the Delta strain, you may be shedding just as much live virus as someone who's unvaccinated. And so for a lot of people that weren't vaccinated, that just kind of removed an incentive for them to get vaccinated because they figured, well, what's the point? So aside from, yes, the vaccines can still protect you from serious illness and death, we also are finding out more evidence that even if a person is vaccinated and they are infected with the Delta strain, the longevity or the duration of time that they have those infectious virus particles that they're able to spread onto other people is actually reduced. And so, someone who's unvaccinated may be more likely to have those infectious particles that they're spreading onto someone a lot longer than someone who's unvaccinated. The other thing too, aside from, death and being hospitalized, there are other long-term lingering side effects, or I don't want to say side effects, but long-term lingering symptoms that people have developed as a result of COVID infection. We saw this with the earlier strain of the virus, and we're seeing it with some of these newer variants that have come out. And that ultimately can lead to absenteeism. So one of the main things that people, mention is that they have just kind of chronic fatigue. They develop almost a chronic fatigue syndrome. People are reporting issues with memory and focus. And that is leading people to call out of work. I've had some of my own patients who are just saying like, I don't have the fever anymore. I'm not coughing as much, but I just don't feel like I'm back to my usual self. I don't think I can go back to work, or, I tried going back and I just couldn't perform the way that I used to. And so that is another, potential issue that people could have. And also for employers, that would be a potential hit to the workforce as well too. If we have a ton of people that get infected with COVID, even if it's a mild case, can have these lingering symptoms that affect their productivity. And so that's also something that we've been mentioning to patients, is that it's not just you get COVID or you die. There's other long-term symptoms that we're not quite sure how to deal with yet. So we don't really have any treatments for those things, and so that's another reason to try to protect yourself as best as you can.
And Dr. Robinson, I know there's not a lot of data out there that's out in the public, but I think the White House issued that we are going to start booster shots in the fall. What can you tell us just that you're aware of in terms of boosters and the effectiveness of the vaccine and over a period of time?
Yeah, so with the booster shot, so right now, the recommendation is that for a general person who doesn't have any, immunocompromising health conditions, they can wait at that 8-month mark from the last time that they got the date of their second shot. For other people that do have are what we call an immunocompromised state, the concern is that they might not have gotten that really robust response from the vaccine in the first place. And so they need to go ahead and get those boosters now, not wait, 8 months from their second shot. That is a very specific subset of people. So it's either going to be someone who's actively being treated for a cancer or a leukemia or a lymphoma. And part of that has to do with the fact that some of those medications that people are on to treat cancers, it does suppress your immune system. And so those persons may not have been able to develop a strong immune response the first time around with the vaccination. If someone has an autoimmune condition, such as rheumatoid arthritis, such as lupus, and they're on very strong medications, or irritable bowel disease, Crohn's, ulcerative colitis, they're on strong medications that are trying to suppress your immune system because they have a condition where their immune system is actually attacking their bodies and is the cause of their illness. So by the nature of being in those medications, again, they never really develop that strong immune response in the beginning. And so those are patients that would be eligible for a booster right now. Also, some people, I've had people come to me and say, oh, well, I was given a prescription for prednisone. We commonly prescribe prednisone in medicine to treat conditions where we're concerned about inflammation in the body. So if somebody has asthma, for example, and they have a flare-up of asthma, we may give them a prescription for prednisone for a couple of days. The amount of prednisone that someone would have to be on for it to be considered immunosuppressing would be the equivalent of 20 milligrams of prednisone on a daily basis. And this is for someone who's taking this like as a chronic medication, not just for less than 2 weeks or so. And so the CDC has a subsection that really gives advice and guidance on immunizations. And they actually have some very clear, specific guidelines of who are people that we would consider to be immunocompromised that would be eligible for a booster. With that being said, the CDC has also said, hey, that someone can self-attest that they're immunocompromised. So, if they were to go to say like a CVS or a Walgreens and mention that I have an immunocompromising condition, there's not that many barriers in place in terms of preventing that person from getting vaccinated. But in my experience, a lot of patients are actually going to their healthcare providers and saying, hey, do I qualify for this? And if I go through the list and say, hey, actually you don't. So most people are okay with that. Say, okay, well, I'll just wait my turn when that 8-month period is up. But when they looked at the studies, they basically saw an increase in the antibody response after doing those booster injections. And we also have some patients that have been vaccinated against Johnson & Johnson. And so I've had quite a few people that have been calling and been kind of concerned about like, well, should I get the mRNA vaccine? Should I get another Johnson & Johnson booster vaccine? There are 2 studies that are being conducted, one looking at people that got a Johnson & Johnson vaccine and then got an mRNA vaccine as a booster, and then those who got a Johnson & Johnson vaccine and got a second Johnson & Johnson vaccine. And so that data is going to be coming out pretty soon. What I've told a lot of my patients is just to be patient and hold tight, because I want to be able to, just kind of have a conversation with them about the data from those studies before jumping the gun.
Great. We have about 10 minutes left, so I'm going to have each of our panelists wrap up here. But so let me turn back to Sarah. And Sarah, I guess are you starting to see people come in looking for that booster shot. And then also you did throw up on the screen a list of percentages, and I see it's, you know, those younger groups that have the lowest percentage of taking the vaccine. How are you guys trying to reach out to them?
Yes, thanks. So we have done a lot of focus on that younger group. So we're doing a lot of back to school stuff, getting kids to meet them where they are. So doing a lot of sports things, events like that, and then really changing a lot of our messaging. So a lot of our messaging in our Facebook and social media, using a lot of teenagers and trusted messengers. So people in the community that are recognizable for whatever reason, positive reasons, to try to make it more easier to understand and bring it home to the kids really that need it the most right now, because we are seeing more and more kids and younger adults getting hospitalized. So we really want to make sure that we're making that effort to get those younger. We are doing an amazing job with our older people, and they will be our first set of boosters. We do get a lot of questions about the boosters right now. We have a lot of stuff on our website and posted in our offices on those conditions that are specific to the third dose, because there is some confusion. And I know that we're getting we've asked for a one-page flyer. What's the difference between the third dose and booster from DPH? And they said that should be coming within the week. So we can always get that out to your group if you guys need it. It's always good to have like a nice one page, am I eligible, yes or no? Because it can be so confusing with information changing all the time. And just know that if you ever have questions, you can always reach out to one of us. Dr. Robinson's amazing. She's got the best way to explain everything in just easy terms to understand. So we use her information a lot. And then we just make sure that we're available for the vaccines.
Great, thank you, Sarah. Emily, let me, as we're just talking about the changes with the pandemic, and when people were first starting to think about vaccine mandates, many of the things we just discussed were not part of the knowledge base, and even factoring in when are you going to have to show proof that you had that booster shot. So how do employers keep up with these changing conditions?
Sure. So it's tough because the information is coming from so many sources. We have the CDC changing their guidance all the time. We have the EEOC coming out with their guidance. So definitely remaining up to date with those sources, with what the state is putting out. I mean, we saw the state implement vaccine mandates for nursing homes. So keeping up to date on that information. Not just saying this because I'm an attorney, but it definitely helps to have legal counsel, just because, like I said, these issues are rapidly changing. They are complex. You want to make sure you're implementing a mandatory or voluntary vaccine policy according to the law. So definitely helps to have legal counsel. Pay attention to all the sources out there. Pay attention to what the states and the localities are doing. And yeah, it's crazy times we're living in, but definitely don't hesitate to reach out if you have any questions. I think Garrett has my contact information, so don't hesitate to reach out.
Great, thank you, Emily. And feel free to put your contact information too in the chat for anyone who wants to reach out to you. Stephen, obviously last year was a really challenging year for all the colleges and universities. I'm sure you have a lot of contingencies in place for lots of different possibilities. I guess, what are some of your worst concerns that you could have for the school year, and how are you guys planning to deal with them? You had a great test run last year and very successful.
Yeah, no, thank you. We did. We were fortunate to really have our positivity rate last year totally be under 1%. So we really had some good practices in place. So I had weekly calls with my colleagues at other schools on the Connecticut Conference for Independent Colleges, the CCSE. So we really work together and kind of share different strategies, see what each other are doing, and learn from each other. So I think all of our worst concerns are if we do have more of an outbreak, if the Delta variant kind of does take hold in some of our residence halls, and then we have to move to more of the sort of isolation and quarantining approach. We are bringing back our students fully. So we have fewer spaces to offer as isolation or quarantine, although we are reserving some rooms. We're hoping not to have to use them, but I think that's always the greatest concern. You know, we're always willing or ready to have to pivot if we need to. We certainly had that experience of having to pivot on a dime in March of 2020 and really have to move everything online quickly, and which we did fairly well, you know, given the circumstances. So we're really just ready to do that if necessary, and or take things, you know, approaches like some schools have done of ending the semester a bit early for on campus and completing the term online. Again, we're hoping not to do that. We're really hoping that with the full vaccinations and with our requirement policy that will provide the safe environment so that we can really be uninterrupted this year.
Great. Thank you, Stephen. Appreciate it. And best of luck with the semester.
Thank you very much.
Frank, let me bring you in for a final thought. And I heard you say, as we were talking, that, you know, more and more other restaurants are starting to adopt these policies. I guess, so are you concerned about people's interest in coming out as more and more people are talking about the Delta variant? And I guess hoping that by having this vaccine policy in place, that defeats some of the concerns people would have about coming out and eating at bar and going to the nightclub.
Well, I think, you know, when you consider all the negative pushback we got because of this, in the end, people are going to come to appreciate this. You know, throughout the summer, our dance club was very busy, and you know, every evening I'd have people come out and be like, "Wow, I think I just got COVID in there." So I think in the long run, and people are going to come to appreciate it and want to go there more because they're going to consider, you know, a much more safe environment. And as time goes on, I think this is really going to be the norm for a lot of large event spaces. I think they're going to need to do it. So hopefully in the near future, any of this pushback is going to go away, and people are going to come to our door expecting to show the proof of vaccination. In the long run, it's going to be helpful for us.
Great. Thanks, Frank. We really appreciate it. And I should mention, Frank and Bar is going to be one of our featured locations at our Public Policy Summit on August 31st, so next week, so you can still sign up for that. Let me turn to Sarah Westby. And Sarah, one last question for you. Just, is there a shift that can occur here where employers or locations that don't have mandates or requirements take on liability from their customers and their employees? Is that something they should be concerned with?
Yeah, and I think that is the main concern and hesitation, Garrett, with mandating vaccines. You know, employers are concerned about whether their employees might sue them if they have an adverse reaction to the vaccine. There's workers' compensation considerations, there's sick and medical leave considerations. I think with the full approval of the Pfizer vaccine, employers have that extra added level of comfort that this is something that's been deemed safe and effective by FDA, looking at the full slate of medical data over the past, 6-8 months that this vaccine has been out there. So I think that helps to mitigate that risk, but that is a concern, and it's something that we're hearing about, and it's something that every employer has to evaluate based on their specific workforce and the population that they serve and their work environment. The countervailing consideration there is, if you allow people into the office who are not vaccinated and they spread the virus, do you have liability that way? So they're tough things that the employer needs to consider. And again, you can consult legal counsel. I put my information in the chat as well. But again, no one size fits all approach here.
Great. Thanks a lot for your help, Sarah, today. And I'll close out with Dr. Robinson. We'll give you the last word, Dr. Robinson, just on what would you recommend for people who are either going to outdoor events, going to indoor events? What are the best ways to keep yourself safe, hopefully in these, only just in the next few months, but as we continue with this pandemic?
Yeah, I think now we're still technically in summer, so I would say use that weather to your advantage. So if you can attend as many activities outdoors, that would definitely be preferred. I think somebody had asked a question about, hey, if we're requiring testing for an event or a venue, like, how soon should people be doing that? Usually I recommend, the same thing that's been being used when someone has to fly somewhere or fly into the United States. and show proof of a negative COVID test, we typically would recommend doing that test within 72 hours. And that's just because, COVID still has that delay where you can be exposed to something, but then maybe not really generate enough of those virus particles to be detected on the sample until a few days later. And so if you are exposed to someone and then get tested the very next day, you may have a false negative test. But overall, I think, trying to do as much stuff outdoors as possible while the weather is still good makes the most sense. As we start getting into the fall and winter months when it's a little bit cooler, and things move indoors, then you really have to be careful about, okay, limiting maybe the types of people that you're socializing with at that point. And if all of those people are vaccinated, even better.
Great. Thank you so much, Dr. Robinson. I want to thank all of our panelists, Healthcare and Life Sciences Council, as well as our HR Council and Carmody and Harvard Pilgrim Healthcare as well. Thank you for supporting this program today. And I'll just leave everyone with this last thought that we have our annual policy summit and summer bash coming up on August 31st. We're going to be talking about transportation, high-speed rail, the airport, how you get here to New Haven. We're going to do that in person at the Schubert, but everyone will be wearing masks. And then we're going to break out for networking at downtown restaurants, including bars. So please go to our website, sign up, and we hope to see everyone there. And thanks again. Have a great rest of the summer, everyone. Appreciate it.